Scientific evidence is a crucial underpinning of clinical practice. Nevertheless, the first series of articles aimed at providing clinicians with guidelines for critically appraising the evidence that informs clinical practices appeared in 1981. 10 years later, the term evidence-based medicine first appeared in the medical literature. The first article to use the term evidence-based dentistry, EBD, was published in 1995. However, it is still not easy for dental practitioners to understand critical appraisal and use of evidence in oral health care fields due to lack of learning tools and resources. The American Dental Association defines EBD as an approach to oral health care that requires the judicious integration of systematic assessments of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, with the dentist's clinical expertise and the patient's treatment needs and preferences. The definition of EBD has three main components: best current research evidence, clinician's expertise, patient's values and preferences. One definition of evidence is any empirical observation, whether systematically collected or not. Evidence can be obtained from a range of sources, including clinical observation of the course of a single patient or a multi-center and multinational clinical study. Unsystematic clinical observations of a small number of patients are more likely to introduce more bias than are appropriately designed and conducted clinical studies. For each type of clinical question, there is a hierarchy of evidence that is based on the degree of trustworthiness. For instance, to answer questions regarding the effectiveness of a particular intervention, the strongest evidence would come from randomized clinical trials with a low risk of bias and large sample sizes, as such evidence provides more precise estimates and more consistent results, and is directly applicable to the patients at hand. If findings from such studies are not available for the specific question of interest, clinicians must rely on less trustworthy evidence, including well-designed and conducted observational studies, such as cohort and case control studies. If no randomized trials, cohort and case control studies, or case series case reports are available, individual observations by a clinical expert may become a valuable source of evidence. The relevant course components will address the hierarchy of evidence for each type of clinical question, that is, therapy and prevention, harm, prognosis and diagnosis, and how to appraise the relevant literature critically. The process of EBD. The decisions clinicians must make in daily clinical practice are the most important source of questions for which we seek evidence-based solutions. Such questions constitute the starting point of the EBD process, which encompasses the following main steps: translating the clinical question into a well-formulated searchable question format, searching for the best available evidence to answer this question, critically appraising the evidence and applying it to the particular clinical scenario that motivated the question. To translate a clinical question into a well-formulated searchable question, it is necessary to identify four main components of the question: the patient or population of interest, the intervention, or exposure or new diagnostic test strategy, depending on the type of the clinical question, the comparison, or reference standard, depending on the type of clinical question, and the outcomes of interest according to a patient-centered approach, hence, PICO. Examples of the PICO approach for the variety of types of clinical question will be discussed in the relevant section of the course. The PICO components of the question at hand are used as the basis of searching for evidence in the literature by using electronic databases and other sources. There are a number of sources that provide clinicians with useful information. Depending on the degree of detail sought, information from primary studies, summaries and critical appraisals, and clinical practice guidelines may all provide evidence. Choosing the most relevant source to search in any particular case is discussed in the relevant course section. Once a clinician obtains the evidence to answer the clinical question at hand, it is necessary to conduct a critical appraisal of the evidence discovered. As will be described in the relevant section of the course, the critical appraisal of individual primary studies has three main domains: risk of bias assessment, results, and applicability. The first domain explores whether the study was designed and conducted in a manner in which potential biases were minimized. The second domain is an interpretation of the results of the study in terms of direction, magnitude, and precision. The third domain contextualizes the available evidence to determine implications for clinical practice. Scientific evidence constitutes one of the fundamental tenets of dental practice. Evidence-based dental practice integrates the use of the best available evidence, clinicians' expertise, and patients' needs and preferences to inform decision-making in clinical practice.